Okay, let's talk about our test 4 review. This is chapters 9, 10, and 11. And this is going to be kind of a fun chapter or a test review for me because this is what I do on a daily basis and what I like about athletic training in general. And because, you know, this is deals with injuries and how we treat them on a daily basis. All right, let's get started. I deal with our important terms. Our first two terms, sprains and strains, people tend to get these mixed up or use them interchangeably, and they're not the same thing. A sprain, this is an injury to a ligament, all right, and a ligament is, of course, connects the joints. All right, and this is we're talking about the ankle or the knee or sometimes in the shoulder, of course, but most of the time that's going to be a strain also. But strain, this is an injury to the muscle or the tendon. Okay. Elasticity, we've had this term before. This is a soft tissue. This was when the soft tissue returns to its normal function or formation after an injury. This is when you get a nasty sprain, ankle that blows up real big, or a knee, they blow up real big, and then you get all that fluid out of there, and then it returns back down to its normal formation. Compression, a force with enough energy that it will crush the tissue, and this you're going to see most of the time more in like a car wreck or something along those lines. But you can see these in sports like football, sometimes in baseball, depending on what the heck is going on and what type of force or energy goes along those lines. Margination, this is leukocytes line up along the wall of the blood vessel. Gait theory, okay, this is our main pain theory that we use, and it's used to establish the ability of the dorsal root of the nerve to inhibit the pain impulses to the brain cortex for perception. Fractures, these are injuries to the bone resulting in a break. A lot of times people say, I broke my bone, I didn't fracture it, or I fractured my bone. It isn't a break, but a break is a fracture. A fracture and a break are the same thing. Not two totally different things. They're the same thing. Okay. And we'll go over the different types of fractures here in a minute. And we'll talk more about that type of stuff in a minute also. Fibroplasia. This is a period of scar formation. All right. Our next slide. All right. Types of sprains. All right, of course, you got your grade 1, which is mild. This is the stretching of the ligaments, usually just 1 or 2. Example is your ankle. Usually you're going to get your ATF, which is in the front of the ankle on your lateral side, which is the outside of your ankle. You have the long bone on the outside of the ankle or the leg called the fibula, and on the end of the bone is called the malleolus, and that's your ankle bone. And the ATF attaches to the front of it and then attaches down into the foot. And a lot of times that is the ligament that is sprained during a normal ankle sprain, just a grade 1 ankle sprain. And a lot of times a grade 2, you'll get that and what's called CF ligament. But we'll go over, you know, the ACL with that because that's what's more commonly what people associate with that. Grade 2, that's more moderate. You have stretching and some tearing of the ligament, and can be multiple ligaments involved sometimes. And like I said a while ago with the ankle, An example of this, knee sprain, this is partial tearing of your ACL, or sometimes, and you'll get a lot of stretching out. I'll give you an example of that. Me, all right, when I was a senior in college at Blue Mountain, I was playing intramural basketball. I went out and I was on defense. I went one way, the girl driving the ball went the other way, and stretched out my ACL. And at first, we thought I had just dislocated my kneecap, but it turned out that I had partially torn my ACL, and we didn't find that out until he got in to do surgery on the meniscus part, which is the cartilage on the inside of the knee. Grade 3, this is a severe injury. This is a complete rupture of the ligament, which usually is in the middle of the ligament. Sometimes you can have what's called an avulsion fracture, which is where a partial piece of the bone comes off, usually of the femur, and it'll pull off and take the ACL with it, or the PCL. And in those cases, the doctors are able to go back and tack that back on, and they don't have to have a graft. But in cases where you rupture it in the middle of the ligament, which is what I did the second time when I completely tore my ACL and had to have ACL surgery, then that is where let me show you the ligament ruptures here in the middle. Okay, so they have to take a graft, and I used my patella tendon, and they took the patella tendon and they run it through let's say this is the tibia, all right, and this is the femur where it meets up here. Okay, they run it through a hole down here and come up through a hole up here and take it to the graft through there, and that's how they fix it and make your ACL. And it's pretty cool. I've watched several surgeries, and I like to watch those type of things. Okay, all right, let's talk about strains. Types of strains, you've got your grade 1, which is mild. These are some fibers are stretched or actually torn. You get some tenderness and pain, but they'll have full active range of motion, and usually you can ice, rest them, let them go back in about a week or so. Grade 2, this is moderate. You have several fibers that are torn. They're very painful when they contract the muscle. You ask them to pull, like hold the leg, let's say it's a hamstring, you have them pull the foot toward their butt and tell them to hold it there, and when you go to pull down, they're not able to hold it, and it's very painful, and you'll feel a divot or a hole or some kind of depression when you're palpating to see, and you may feel swelling, and you'll definitely see discoloration or bruising. And in cases like that, they're out anywhere from 3 to 4 weeks usually, depending on, and usually these are the ones I send to the doctor. These are grade 2, grade 3 are definitely going to the doctor. On sprains, usually grade 2, grade 3, yeah, they're definitely going to the doctor. Grade 1, usually give them home exercise program, and then I'll treat in the athletic training room at the school. Grade 3 strains, these are surgical, just like grade 3 sprains are. All right, these are severe. This is a complete rupture of the muscle or a muscular tendinous junction, and like I said, they're not going to have pain because they will right at first, because you're going to get that nice little snap, And of course, you'll have that nice burst of pain, and then you won't have any because you'll have nerve damage. And the doctor will have to go in and repair the muscle. All of that because of all of that. All right, let's fractures. All right, we have, these are the 6 main types of fractures. All right, we have the green stick, commutative, linear, transverse, non-displaced, oblique non-displaced, and spiral. All right, usually on this green stick, if you look right here, they call it the green stick fracture because it looks like if you took a limb off of a tree that is still green and you tried to snap it, it would crack like this right here. And that's what it looks like in an arm that somebody gets these. And lots of times this is going to be in kids, and unfortunately I think it's a lot of times the kids that are abused. Commutative, this is literally looks like the bone exploded. These usually are surgical. They usually have to go in and possibly put some kind of plate in there or possibly a rod. Linear, they can usually put, as long as it's not a weight-bearing bone that they think they're going to have a problem out of, along with these two, the transverse and the oblique non-displaced. They can usually just take a cast, put them in a cast, and let them go. The spiral, a lot of times they'll have to line it up correctly and possibly put a pin in. Impacted, depressed, they are what they sound like. Okay. Okay. Bones, they are used to protect our organs. They also are used to support our body, and they're also used for hemopoiesis. And but we all, so we have to keep them protected also because they're very important to us. So we want to make sure that they stay healthy. Okay, so as we're growing, you can have something called a Salter-Harris fracture, and there are 5 different types, and they usually happen in the growth plate area, and that's up in this part of the bone. All right, and like I said, they're classified into 5 different types, 1 being the least and 5 being the most. And a lot of times these get misdiagnosed. A grade 1 Salter-Harris fracture, if you don't know what you're looking at, you're going to miss it. You may say it's just a normal little ankle sprain or hyperextended knee when it's actually a fracture, so that you need to make sure that, especially with a kid, that they're referred to the correct place, like an orthopedic surgeon or a kid that or a person that knows what they're doing, like the pediatrician. Okay. All right. So let's talk about avascular necrosis, because a lot of times with bone, you can get avascular necrosis if it's not getting a good blood supply after it has had an injury to it. And this really happens with these little bones, like these carpal bones in the wrist. And let's use this one right here, the scaphoid or navicular, as an example. It has 3 different sections that we really want to consider. And this very top part up here, or this 1/3 part up here of it, usually if it fractures, a lot of times number one, you're not going to see it. But number two, if the blood supply doesn't get back to it, you can get avascular necrosis. And a lot of times it's missed, okay, until it's too late. All right. The constant remodeling of bone is due to osteoblast and osteoclast. Now stay with me here, because osteoblast means builds. It rebuilds the bones, okay? It builds bones. And osteoclast breaks it down. It breaks the bones. Okay? So just remember that when you're going to think of these things, because a lot of times, I know when I was first learning this stuff, I would get them backwards. All right. Let's talk about head injuries and fractures of the skull. All right, you have contrecoup, and that means a fracture on the opposite side of the injury. So let's say I can't draw very well, and obviously I can't write very well on the screen with the pen, but let's say that's the head, and you have a ball coming at it right here, and it hits right here. All right, the fracture happens on this opposite side over here. That's the contrecoup, okay? Usually you're going to see this more, that more in like probably car wrecks and that type thing. All right, let's back up and let's talk about ligaments, okay? Ligaments, and I'll go back. Okay, now remember that let's talk about, because I didn't get to talk about myositis ossificans a while ago. These are bony formations that can occur when you get an acute injury to a big muscle, and this can cause you to have some kind of surgery to have them removed, and you definitely don't want to do that if you can help it. Tendinitis. This is a gradual onset with diffuse tenderness, inflammation, and crepitus. Usually where you're going to see this, you can get this in your shoulder with biceps tendinitis. You can get it in your elbow. You can get it in your knee. You can also get it in your Achilles. You can get it in your ankle. So you can get it just about anywhere a tendon and a bone meet. It's real easy to treat. Usually we treat it with gentle stretching, ice, ibuprofen, Aleve, Advil, you know, some kind of NSAID along that way. If that doesn't help, then we'll get them to the doctor, let them prescribe formalized physical therapy, along with maybe something like Mobic, you know, higher dose NSAIDs, things along those lines. Capsulitis. This is a chronic inflammatory condition that may occur after repeated sprains or microtraumas. Referred pain, you're going to get hurt in one area, but you're going to feel it in another. Like, let's use your spleen, for example. You get hit in the stomach and you injure your spleen, you're going to feel it in your left shoulder. Nepraxia. This is when you feel pain or discomfort during exercise. Osgood-Schlatters disease. This is microtrauma and abnormal repeated stress. This is from growing too fast, usually, and you're going to have this in your knees, and it's usually the patella tendon. You'll have pain along it, and there'll be a knot right there on the tibia, and usually treat it just like kind of like we do tendonitis, but usually formalized physical therapy, and those patella tendon bands to help take the stress off of it, because you don't want them to avulse that patella tendon off, because if you do, then you're going to have issues, because that means surgery. Remember that you always want to think about your patient, because they're always, you know, going to go through when they get injured, they're going to go through those responses that we talked about in class the other day when we did the online, when we talked about they were going to go through the grief responses. Okay, they're going to be mad at first. They're going to be angry. They don't know why they got injured, and they're going to be just totally angry about it. Then eventually they're going to go through some kind of depression phase. All right, and so that athletic trainer's got to be ready to handle all that. The coaches have got to be ready to handle all that, and if they're not, then, you know, the kid's not going to be able to handle it, or the athlete. And so you got to be able to help them to eventually move into and finally into the acceptance phase, and help them get through all of this and get to where they need to be so that they can get back to where they can function and get back into where they want to be, which is back into athletics. Okay. Remember that histamine is a powerful vasodilator, and it's found in the mast cells. And I'm trying to see if there was anything else that you might need to know. Endorphins, these are produced in the hypothalamus. Inflammatory response is a loss of function, swelling, and pain. Let's see. All right, injuries usually occur at the musculotendinous junction, bony attachment, and the muscle belly. All right. I think that's about it. If there are any questions, just reach out to me online or call my cell phone. Good luck on your test. Thanks.